Hello and welcome to News 9 Facebook Live with me, Adarsh Vepachedu. The winter is beginning to set in, and with it comes a range of problems and challenges, especially with the festive season and the rising pollution levels. But what's worrisome is that there are more reasons than one as to why the younger lot may be more at risk of catching COVID-19. Let me first present a statistic that will bring some context to the show. As per an analysis by the Union Health Ministry, nearly half the people who have died of COVID-19 are aged below 60 years. What also forms part of the context is that countries like Russia and the United Kingdom are already experiencing what's being called a second wave of COVID-19 infection, and we simply cannot rule one out here in India. For instance, the National Center for Disease Control has warned Delhi of witnessing around 15,000 COVID-19 cases daily in winter because of the prevalence of respiratory illnesses during this season that worsen symptoms of the disease, and underlying health conditions among young adults only add to the woes. Truth be told, since we are not going to get a vaccine anytime before mid-2021 and with winter to go through, it becomes all the more important for us to highlight the importance of paracetamol and also educate about the correct dosage of the same. So how will winter play its part in the pandemic? How and why are young people more at risk? And how do we work our way around paracetamol? To answer some of these crucial questions, we have with us senior physician Dr. Abdul Aleem joining us on the phone line. Many thanks, sir, for speaking to us. Now, don't undetected conditions of diabetes and hypertension among young adults make them more vulnerable to COVID-19? And also coupled with the festive season and the winter setting in, sounds like a vicious combination, especially with reports of a second wave across various countries doing the rounds. Your thoughts?
Yes, good afternoon, Adarsh. You have given a very good overview of the winter season coming in, and most of the young adults, the college students and various other young adults, they keep going out without using the proper, operating procedures which have to be standard operating procedures, SOPs which have to be followed, and most of the young adults, they have this hidden diabetes, hypertension, cardiovascular diseases. These are nothing but the silent killers which they go underdiagnosed, and most of them don't get tested. Suppose they have these problems which is not diagnosed early, and they also have this infection, then it could be even more worse. And in the winter, more respiratory problems, lung ailments are there to set in, and especially Delhi, as you said, is one of the main cities, and you have Bangalore, Mumbai and other places, cosmopolitan cities, where this trend is going to go in a very big way. So hence, what I suggest, you said about various other measures which the young adults should be taking is try to restrict their movements and follow the standard operating procedures laid down by the Government of India and the Health and Family Welfare Department. This is most important, which we have to follow, rather than, just going out and say, no, COVID is gone and everything is going to go normal. This is not the scenario.
True. Dr. Abdul, as temperatures drop, instances of conditions such as cough, cold and fever also rise. Self-medication is so common in India despite the fact that it is not a recommended practice. And one of the most commonly used medication during the winter especially is paracetamol. How important is taking the right dose of it in this season?
See, self-medication is always not good. I always advise everyone, please take the help of your friend who is a doctor or a family doctor or a physician. Nowadays we have online consultations. Please take their advice. Don't self-medicate. I come across a lot of patients. Sir, yesterday I had fever, 102. I took one paracetamol, 650 mg, 500 mg.
That's a high dosage, isn't it?
Yeah, so the right dosing is most important. How many times you should take it, depending on the severity of your fever. You have to take it every 4th hourly or 6th hourly, and you should know the maximum dosage. It goes up to 4 grams per day. You can't exceed. People, they just keep on popping one paracetamol every 1 hour, 2 hours, checking the temperatures, which is not good. You may overdose yourself or underdose yourself. This is most important, which all the people have to follow. and it is better to always seek the advice of a doctor. Don't self-medicate.
Doctor, can we say that a lot of it may be happening because of underlying worry that, you have COVID-19, so the moment you have some kind of a cough or fever, people begin to pop in all these pills just to, make sure and just to ensure that they do not have COVID-19 or fever. So a lot of it is to do with worry, isn't it?
Yes, obviously, yes. Most of them in their tensions, worries, they start self-medicating themselves. They go to the Google, search few things and start popping up tablets. I have seen a few patients who also start some steroids. These are supposed to be used with utmost care. They start using these drugs, non-steroidal and anti-inflammatory drugs. Everything is done on their own. They self-medicate themselves. All types of syrups are. The main problem is the drugstores give them all the medicines required without a prescription. This is followed in our country, which should not happen at all. This is the main cause for self-medication. You get whatever you want without a prescription. This has to be taken with utmost care. We have, through the Indian Medical Association and various other agencies, we have sent so many requisitions to the ministry to stop this giving over-the-counter medication. Some, okay, fine, paracetamol, but there are other drugs which they self-medicate on their own.
True, and that could be very dangerous. Now, doctor, as more and more people, begin staying indoors, especially this winter season, please tell our viewers the importance of proper ventilation and also other do's and don'ts that we must keep in mind coming this winter season and the festive season.
Yeah, in winter season, most people try to, be warm and cozy and shut all the windows, doors. There is no proper ventilation. Once you don't have good oxygen coming in and going out fresh air, that leads to certain levels of stagnant air inside the room, which study shows that it harms the body and could lead to various other infections. So always fresh ventilation, cross ventilation is good. Having fresh air, it's not that you open the windows or doors, something is going to happen. Fresh ventilation is always very good. This is my advice to everyone. And if it is winter also, you try to open at least half a window and a half window on the other side and have some good fresh air coming in and going out instead of having the stagnant air inside the room.
Very, very important indeed. Many thanks, Dr. Abdul, for joining us and for sharing with us your insights on how and the kind of challenges the winter is going to present once it begins to set in, so to speak. And along with the winter, you also have the festive season. So yes, a lot of possibility that many of us, due to various worries and tensions, we may begin to self-medicate, but it is very important for us to find out what we are taking and, more importantly, how much of it that we are taking. And yes, if you're a young adult watching this show, and in case if you have any kind of a doubt that you may have hypertension or diabetes, it is always better to get yourself checked and keep those issues in check so that they do not become a problem in case if you were to get infected by COVID-19. Well, that's the information that we have for you in this brief live interaction. In case if you've liked the information that we've shared with you, do not forget to like, share and subscribe to News 9 on YouTube, Facebook, Instagram and Twitter. Many thanks for joining us.